Hello, and welcome to our lesson on abuse. In this lesson, we'll be talking a lot about what abuse is, what different forms of abuse there are, what they mean, examples of them. We'll talk about how to report abuse, when to report abuse, and the investigation process and everything that goes into that. What abuse is the purposeful mistreatment that causes physical, mental, or emotional pain or injury to someone. There are several different forms of abuse, and they can be anywhere from physical abuse to psychological abuse, verbal, sexual, neglect, exploitation, financial abuse, assault, battery, domestic violence, workplace violence, false imprisonment, involuntary seclusion, um, sexual harassment. There's a lot of different types of abuses that exist out there. Some different examples are things like yelling, obscenities, threatening to hurt others, hitting or causing physical pain to a resident are another example as well. So, unfortunately, abuse happens a lot more frequent than people really know and understand. It's our job to make sure we know what abuse is, when to report it, how to report it, and sort of what goes into the investigation process, as well as suspicious injuries, suspicious behaviors that we should be looking out for and reporting to the nurse as well. The first type of abuse we're going to talk about is physical. What physical abuse is any mistreatment, intentional or not, that causes harm to a person's body. Slapping, bruising, cutting, burning, physically restraining, pushing, shoving, excuse me, or even rough handling. So being rough with the patient, not being gentle, could fall under a physical abuse as well. So this is a good sum up of physical abuse. Psychological abuse is going to be any emotional harm caused by threatening, scaring, humiliating, intimidating, isolating, or even insulting a person, or by treating him or her as if they were a child if they were not. So, verbal abuse is going to be abuse that is involving spoken or written words. It could be pictures or gestures. What it does is these things are going to threaten, embarrass, or insult a person. This could be yelling obscenities, calling names, um, threatening. Anything along that nature is going to include verbal abuse. Sexual abuse is another type of abuse that could happen potentially to a patient. And what this is the forcing of a person either to perform or to participate in any sexual acts against their will. This could be things like unwanted touching, exposing oneself to a person, or even sharing pornographic material to somebody that doesn't want to see it. Financial abuse is unfortunately something that's very common, especially in the elderly population, those with cognitive impairments as well. So, what financial abuse is it's the improper or illegal use of a person's money, possessions, property, or any other assets. Um, what typically happens is what we see is when these people are unable to make any financial decisions or proper decisions, what happens is they give somebody legal power to make those decisions for them. And a lot of times this is in their best interest. However, unfortunately, there are times they get taken advantage of and people will empty their bank accounts, sell their houses, or move into their houses or take ownership of them. And it can be very difficult for them to get that back and can be a very, very hard situation. So, anytime this happens, I always tell people is if you overhear something, it just sort of gives you a gut feeling, or you overhear something, um, a family member, a loved one, a friend, or somebody over talking about money or anything like that, let your supervisor know, and they can go from there on if they need to address the situation or not. Um, if you feel like they're trying to take advantage of them, if what you hear is something along those lines where you feel like they're trying to persuade them to do something they probably normally wouldn't do, but maybe because they're confused, they're agreeing to it. Anything like that. We're our patients' advocates. We're there to look out for them. Obviously, you wouldn't address that family member or loved one, but talking to your supervisor would not be a bad thing. Assault and battery is another form. What assault is the threat to harm a person. And what that does is result in the person feeling fearful that he or she will be harmed. Now, battery is the actual intentional touching of a person without his or her consent. Now, domestic violence can be any type of abuse, whether it's physical, verbal, sexual, or emotional. And domestic violence is defined as an abuse by a spouse, an intimate partner, or a family member. False imprisonment and involuntary seclusion. So, false imprisonment is the unlawful restraint that affects a person's freedom of movement. So, this could be the threatening to or the act of actually physically restraining a resident. Now, in the state of Michigan, our nursing homes are not allowed to use physical restraints whatsoever. So, in general, if you are at a facility that it's allowed to working in the hospital, the only time we ever physically restrain anybody is if they are being a danger to themselves or others, and we are doing it for their safety. But once again, in the nursing homes in the state of Michigan, physical restraints are not allowed. Involuntary seclusion is the separation of a person from others against that person's will. So it'd be like somebody confining a resident to the room for a non medical reason. Workplace violence and sexual harassment are more about you as the employee. So this is when abuse happens in the workplace by a staff, to a staff by other staff members, residents, or visitors. So sexual harassment could be any unwelcome sexual advancement or behavior that creates some type of intimidating or hostile or offensive working environment. Now, neglect is another pretty common form of abuse that we see, unfortunately. And what neglect is the failure to provide needed care that results in physical, mental, or emotional harm to a person. So, this is basically the failure to act to provide the proper care for a resident that results in some type of injury. So, it's not doing what you should be doing to help the resident and to properly and safely take care of them. Some red flags that might indicate that neglect is happening are pressure ulcers, body not being clean, body lice being present, unanswered call lights, soiled bedding, weight loss, or even dehydration. So, not all of these things are going to mean that somebody's being neglected, but they could potentially be red flags that it is taking place. So, we always just want to be looking out for our patients, making sure that we are doing everything we can to give them the best possible care. There are two types of neglect. There's active neglect and passive neglect. The difference with the two is pretty simple. Active neglect is purposeful failure to provide care. So you know you need to be doing something and you're not doing it. All right. Passive neglect is unintentional. A lot of times this happens from a lack of education, a lack of training, them just not knowing or understanding what the residents' needs are. So that's the difference between active and passive. Now, the difference between negligence and malpractice is we sort of cover negligence, right? The failure to act or provide proper care. Malpractice occurs when a person is injured due to professional misconduct through negligence, carelessness, or a lack of skill. So there are going to be times where there's certain injuries or behaviors that can be a little suspicious. They might raise those red flags, um, where we should definitely report any of these to the nurse, to our supervisor, to let them know what you're observing and what you're reporting. So some suspicious injuries that might raise those red flags are things like poisoning, traumatic injury, teeth marks, belt buckle or strap marks, bruises, scars, dislocations, fractures, burns, scratches, or even swelling in the face. Any of those could indicate, especially things like those teeth marks, the strap marks, bruises that we can't identify where they came from. Um, different things like that. Those are some big red flags that, once again, we wanted. Obviously, these are also things that the nurse should be notified about immediately, whether it's suspicious that it came from abuse or not. But they definitely would entail further investigation on how that happened. Now, some suspicious signs or behaviors would be things like yelling, fear or apprehension, poor self control, constant pain, threatening to hurt others, withdrawal, any agitation, low self esteem, mood changes, or if a visitor or staff is not allowing the patient to speak unless they're present, that would be a huge red flag. Most of the time, when that occurs, that's because they don't want them to say anything about the abuse or something that's going on. So they'll only allow them to talk when they're present, or they'll speak for them, even. Those are some definite things that you want to report. So, when it comes to reporting abuse, the biggest thing that I want you to understand is that this is not an option, it is the law. All right. The second you find out about abuse, whether that is you saw abuse happening, a resident told you that they were abused, um, anything along those lines, if you do not report it, you are just as guilty as the person that was abusing them. What's also important is that you report it immediately. I've had situations where people have waited, went home, thought about it, then report it the next day. Well, that whole time we don't report it, what's happening to our patient? They're getting abused, right? Or potentially getting abused. So it's very important that you report it and you report it immediately. And remember, it's the law, you have to report it. Now, who do you report it to? It's a great question. So typically we follow the chain of command, our charge nurse, then our nursing supervisor, assistant director of nursing, or our ADON, or our director of nursing, the DON. Every nursing home also has an abuse coordinator. Um, a lot of hospitals do as well. And that person in the nursing home is typically the administrator. A lot of times in the hospital setting, the social worker is going to assist and deal with uh, abuse type cases or potential abuse cases. But the important thing is that you're telling somebody. If you don't feel comfortable with the one of these, then go to the next person. Now, when we report it, I'm going to get into a few slides on what that investigative process looks like. It is not your job as a CNA to investigate, it's your job to report. Once you report it, basically the facility is going to do investigation, and they may have to notify the state and also the local law enforcement, which both of those places might also, or agencies may also, do an investigation themselves. Now, after you report it, if you feel like no further action was taken, what I suggest is always follow up with who you reported it with. Go to the abuse coordinator, go to whoever you reported it to, and ask them, like, hey, I just wanted to check in and see what happened. Now, when you report an abuse, typically we're going to have to fill out an incident report. You're going to have to make a statement about what happened or what was reported to you or what you witnessed. They're going to get other statements, they're going to collect other evidence and do that full investigation. Like I said, we'll talk more about a little bit later. So, after all that happens, they'll deem whether they believe abuse happened or not. These other agencies will go in and look at it. But if no appropriate action, or you feel like no appropriate action was taken by the facility, you can call the state abuse hotline, which is an anonymous call. Um, and let them know about the abuse. Now, obviously, this is never the first thing you would do. This is after you've reported to your facility, you've followed up with your facility, you've voiced your concern, and nothing's happening. Then you could take it to that next step. Now, if the situation is life or death, make sure you remove the resident to a safe place. Have someone or get help, yell for help, or have somebody else get help, but do not leave the resident alone. What you have to remember is anybody has the possibility to abuse a resident. It could be a staff member, it could be anywhere from the care team, from a doctor, a nurse, a CNA, physical therapy, occupational therapy. It could be a kitchen staff, housekeeping. It could be a visitor, a family, a loved one, a friend. It could be another resident or patient in the facility that's abusing a patient. So anybody has the potential, and once again, it's our job to protect our patients and to advocate for them and to do everything we can to keep them safe. So anything that you're concerned about, make sure you're reporting and speaking to through your chain of command about any issues um, when it comes to this. So, what causes abuse or neglect or endangerment? One, typically a lack of training is a huge thing that happens. People not knowing what they're supposed to be doing. This is what a lot of times leads to neglect. Short staffing is a huge thing. People get burnt out. They're in charge of more people than they should be. Um, you know, they just lose their patience and their temper more quickly. They're doing more work. People with violent temperaments are a huge, huge, huge thing. Obviously, this is a field where you do have to have extra patience. You have to be in control of your emotions because it isn't always rainbows and butterflies. The good days will always outweigh the bad days, at least in my experience and many of the others in the healthcare field. However, there are going to be bad days, right? There are going to be difficult patients. So you have to be able to control your temper. You have to be able to be in control of your emotions. So people with violent temperaments are going to be way more likely to abuse a patient. So, this probably isn't the field for you if you have a violent temperament. Inadequate supervision is a huge thing. People tend to follow the rules and to be more cautious when they're supervised. And then hazardous conditions in the facility or environment are going to be important too. Another big thing I want to sort of talk about is knowing your limits and knowing your coworkers' limits. So if you're having a bad day, knowing when you need a break and communicating that. So you're having a hard day and then you have to go take care of this patient that it just pushes your buttons, is maybe a little bit more difficult than others. Communicate to your nurse or your other CNAs or other team members. Let them know, I just need 5 minutes. I just need a break to get myself together so I can go do this. Let them know that. If you see another CNA or somebody that's helping take care of a patient and um, they're having a hard day, give them a break. Let them know you'll cover something because we all need to work as a team. We all need to do this together and help each other out. We just want to be aware of where we're at. We're aware of where our coworkers are at as well. Another thing I get asked by a lot of students is, what if I'm walking by a room and I hear a patient or another coworker yelling at a patient, or um, I see them doing something inappropriate, hitting a patient or whatever it may be? What do you do? Now, obviously, depending on the situation, there could be a lot of different answers for this. My sort of go-to answer and my typical advice is you never want to leave that patient alone, right? You want to make sure they're safe. And since you're hearing or seeing something that's inappropriate, well, my suggestion is you're not going to go in and call the coworker out. But what I like to do is I like to go in there and hey, I just finished up with my haul, everything's good. Thought I'd come in and help you finish up and just sort of jump in and finish helping. That will make sure that, typically speaking, somebody's not going to abuse a patient while somebody else is in the room. Help them finish whatever they're doing, make sure the patient's safe, and when you leave the room, go report it to the supervisor or to the abuse coordinator, right? You always want to make sure that patient is safe. Once again, calling your coworker out isn't going to do anything but possibly make them more angry and could have them act out in different ways. So you want to be careful with that. But that's how I would address it. Patient safety and making sure we're doing everything we can to not leave our patients alone with somebody that is being violent or abusive anyway is going to be extremely important. So anytime abuse is reported, it has to be investigated. Now, the facility itself is going to investigate the abuse, but most times there are very specific times or incidents, excuse me, where they're going to have to report it to the Department of Public Health, and then Department of Public Health will also come in and investigate it. And there's also times where they may have to call law enforcement, which may also have to come in and investigate the abuse that was reported. Remember, it's not your job as the CNA to investigate. Let everybody else take care of that. You could absolutely follow up if you want with your abuse coordinator or whoever you reported it to. Basically, what the whole purpose of this investigation is to determine if abuse actually happened, um, if it did take place, what can be done to fix it, and what needs to be done as far as to the perpetrator or the person that was abusing a patient. Now, the penalties for the facility are going to be things like fines, they could be closed down, they can have different sanctions, and different disciplinary actions. It all depends on if they contributed to the abuse, and the different aspects of exactly what happened. Now, the main person who's going to get most of these penalties are the actual perpetrator, so the person that actually abused the patient. So they could be subject to losing their certification, the inability to work in healthcare or with adults or children ever again. Um, they are most likely going to lose their job. They could have fines, jail, or prison time, all depending on the type of abuse that happened. So, some serious consequences to this. Another thing I wanted to touch base with within the abuse lesson is restraints. So, depending on where you work, are going to be whether restraints are even allowed or not. But first, I want to talk about what restraints are. A restraint is a physical or chemical way to restrict voluntary movement or behavior. A physical restraint is going to be any method, device, material, or equipment that restricts a person's freedom of movement. So, this could be a vest restraint, a belt restraint, wrist or ankle restraints, or mitt restraints, or many of the other ones that exist. Anything that restricts movement is going to be considered a physical restraint. That could be tucking in the sheets and the comforter so tight around a person that they can't move. That would be considered a restraint. Anything that restricts movement. A chemical restraints are medications that are used to control a person's mood or behavior. Now, restraints can be very dangerous and cause injuries when not used properly, not supervised properly, not under the correct orders of a doctor, not assessed, and other things like that. The different injuries that can occur are things like pressure injuries, pneumonia, risk of suffocation, reduction of circulation, weakened muscle and bones, muscle atrophy, loss of bone mass, depression, loss of independence, loss of dignity, and even death could occur. Now, in the state of Michigan, in the nursing home setting, we are not allowed to use physical restraints. The only time that would ever be appropriate to use restraints would be if somebody was a danger to themselves or others. All right? So, in the nursing home setting, whether they're being a danger to themselves or others, we cannot put them in any type of restraint. What we would have to do is, typically speaking, we're going to do everything we can to de-escalate the situation. Do everything we can to help calm them down and to get them into a safe place. If that's not possible, then what we may have to do is call in for the paramedics or even police at times to come in, and the paramedics will then take them to the hospital where they can be taken care of. Maybe there's something more going on with them than just these behaviors that are causing them not to be safe. In the hospital setting, they are able to use physical and chemical restraints. Now, it has to be under doctor's orders. The use of them is very strict. There are very strict rules. Depending on where you work, you have to physically go in and observe anybody on restraints every 15 to 30 minutes, checking the restraint, making sure it's not too tight, not too loose. The doctor's orders have to be renewed a minimum of every 24 hours. And once again, they can only be used if the person is being a threat to themselves, a danger to themselves or to others. You'll see these a lot in the emergency room. You'll see them a lot in the ICU as well. A lot of times when people are on life support, they're on a ventilator, they've been intubated, so they have a breathing tube. A lot of times what people want to do is they will want to pull it out. It's just, even though they might be in a medically induced coma, it is natural to want to put those out. So we put them in wrist restraints to help keep them safe, because obviously they need that tube for breathing. If they pull it out, that's a danger to themselves. You'll see mitt restraints. It almost looks like a little boxing glove that goes on their hand. I'll show you guys pictures of these restraints in a later video. But what that's going to look like is that mitt. It helps because sometimes people want to pull IVs and other tubes out as well, and that mitt can go on there to help prevent them from pulling things out. It doesn't allow them to grip like tubing, like IVs, NG tubes, which is what we call nasogastric tubes, which you'll learn about in nutrition and hydration, among many other ones. So that's sort of the biggest thing I want to touch base on regarding restraints. But I want to talk about some alternatives to restraints, some things we can do to help keep our patients calm, to de-escalate situations, and to keep them safe. So those patients that do have restraints, before we get to the alternatives and preventive, I just want to talk about some things that you should be doing and how you should be monitoring and observing your patients. So once again, always follow your facility protocol. Every place has their own rules, their own protocol on how they handle restraints. So obviously make sure the doctor's orders are in place before you ever apply restraints. And when somebody does have a restraint, this is what I want to touch base on the most, is you should be physically checking on them a minimum of every 15, 13 minutes or whatever your facility protocol is. When you're checking on them, what you want to check for are they complaining of any pain, numbness, or tingling? Are they, if they have a wrist restraint on or an ankle restraint, feel for their pulse. Do you feel the pulse? Is circulation be cutting off? If they have like a vest restraint, which goes across the chest, are they having difficulty breathing? Is there discoloration of the extremities? Are they cold to the touch? Is there swelling? Those are all things you want to look for, and definitely report to the nurse right away if they're complaining of any of these things or you're observing any of these things. Every 2 hours, we typically will want to remove these devices and provide range of motion exercises and then reapply. However, once again, always, always, always follow your facility protocol. So we always want to make sure that call light's within reach. This is one way to keep them safe, and making sure we're answering the call light as soon as we can. All right. We want to make sure there's good lighting. We get the resident up and ambulate them. Remember, ambulate means to walk. Getting them up, walking them, moving them, keeping them entertained and active is going to help keep them safe as well. Providing activity, so once again, keeping them active, encouraging independence, offering them food and drink, offering reading materials, decrease the noise level, something that could irritate a lot of people, reduce pain levels through medications, and also observing and reporting. Repositioning them helps with pain as well. Provide familiar caregivers. All these things might be ways that we can help de-escalate situations, keep our patients calm, keep them active so they're not in danger themselves or others. For this lesson, you do have an assignment. You are being asked to write an abuse paper. So what you should do is you should find an article or video regarding abuse in the healthcare system. So that's going to be any abuse article within the healthcare system. What I want you to write is a one-page paper. And what this paper should include is a summary of the article. So just give me a little bit about the information about the article. Describe the type of abuse that's involved in the article. So was it physical? Was it sexual? Was it neglect? Was it verbal? Then what would you have done, or what could have been done, to prevent the abuse from happening? And were there maybe any red flags that were present that people just overlooked, that they didn't report, that could have been reported and stopped the abuse from happening much sooner than it actually did? And then your thoughts on the article. So once again, a one-page paper, you're going to find an article or a video regarding abuse in the healthcare system. Write a one-page paper that includes a summary of the article, type of abuse that was involved, and what could have been done to prevent the abuse from happening, or any red flags that should have been reported that weren't, and your thoughts on the article. As always, if you have any questions at all, please shoot me an email at kford@h2health.com.